Hi everyone, Dr. Cary Yurkiw here. Welcome to today's webinar on bursitis. Bursitis is something we see quite often in the clinic where there's inflammation of the bursa, and we're going to talk about what causes that and what kind of treatment we can do for that here in the clinic. So bursitis, what is bursitis? And how do you get bursitis and how can it be helped? So what is it? Bursitis is inflammation of the bursa, and the bursa is a closed fluid-filled sac that works as a cushion and a gliding surface to reduce friction between tissues in the body. So it's basically kind of like a sac of fluid there to reduce friction and give the tissue some space so they don't rub together. The major bursa, this is plural of bursa, so bursae, are located next to the tendons near large joints, such as in the shoulders, elbows, hips, and knees. And definitely, these are the more common areas that we see people coming into the clinic with bursitis. How do you get bursitis? Well, the most common cause of bursitis are repetitive motions or positions that put pressure on the bursa around a joint. So it could be some physical pressure, could be the mechanics of the way the joints are working, increasing friction and pressure on the bursa. Examples would include throwing a baseball or lifting something over your head repeatedly, so like a repetitive strain type of injury. Sometimes people at work have this, or athletes. Or even like leaning on your elbows for a long period of time where you're putting a lot of pressure on those joints. As a chiropractor, we look at the whole body when we have somebody with bursitis. We look at the posture, the alignment. We look at the angle of the joints and the function of the joints, and we want to determine what is causing the bursitis. We're going to do a history of the patient. We're going to understand the backstory, but we also want to do a physical examination and really narrow that down to what's causing the bursitis. What are the mechanics behind it? How is the physiology of the body affected? And then once we understand it, we can do the right treatment. So how can it be helped? Well, we want to recommend anti-inflammatory measures like ice or heat. We really want to find the root cause, and we want to correct the cause of the bursitis because we don't want that to come back again. We don't want the symptoms to be reoccurring. We really want to find a solution to what's causing the bursitis. So we're going to look at the alignment of the joint, the function of the joint, and we're going to focus on healing from the inside out. And I think that's something that defines chiropractic, or it makes us unique, is we're looking at the body as a whole, and we're also looking at the healing from inside out. When we talk about physiology, what we're looking at is the alignment and posture. So let's say the shoulders are uneven and there's more weight being put on one side, on the right side than the left side, or even in the hips if there were misalignments. And the posture was poor, you'd have more pressure on one side. The mechanics of the muscles would change, the angle of the joints would change. And then the bursa, which are those sacs of fluid between muscles and bones, or a muscle and a bone and a tendon, that could cause friction and inflammation, and then that could cause bursitis. So we really want to look at the physiology of the body. And we also want to look at the neurology of the body because nerves are traveling everywhere from the spinal cord. And if the bursa is inflamed, it could be putting pressure on the nerve. There could be signals in the area, in the nerve receptors, the pain receptors called nociceptors. And those receptors could be firing, letting us know that there's a problem in the bursa in that one area. So we want to look at the nervous system and understand how that's being affected as well. One of the things that we do talk about in the clinic is lifestyle. And we want to make sure that the patient is not re-aggravating the problem by a poor lifestyle or maybe a repetitive strain type of injury. So we want to talk about the exercises that they're doing, the type of job that they have if there's repetitive strain there. We want to talk about nutrition and making sure that the patient's getting lots of fluids, that they're getting the right nutrients to repair and heal the tissues as we work with them. We want to make sure the patient's getting enough rest so that healing can occur. And we want to focus on that healing process. So we really want to talk about how the body heals and what patients can do to support that process, and the work we're doing in the clinic. If you're interested in a consultation, please feel free to click on the links below. You can come to our clinic for a consult. We do use telehealth as well, so we could do that online. So you're going to find the link in the show notes below or in the social media post. Follow us on social media. Our handle is pretty easy, at Dr. Cary Yurkiw on Instagram, Facebook, and Twitter. We're also on YouTube at the same handle, and for our website, www.caryyurkiw.com. And I hope you can join us for other webinars. Our webinars are listed on eventbrite.ca. We've been really focused on promoting the next 3 webinars. So we try to alternate between free and paid workshops. So we might have a simple topic like bursitis today, where we're going to have a free introductory webinar, but then we do paid workshops as well. So we want to get more in depth into what you can do to help yourself. Let's say a topic like bursitis. What are some stretches and exercises that are good for that? What kind of diet or nutrition can help? So those paid workshops are a little bit more involved. They don't cost very much. They're about $29 per workshop, but we try to alternate those between the free and the paid events that we have here in the clinic, and they're all listed on eventbrite.ca. And if you type in Yurkiw Chiropractic, you'll be able to find those. So I want to thank you again today for joining us here on this webinar. I hope you learned something about bursitis and how bursitis can affect people and how it can develop, what causes it, what is exactly, and then what type of treatments we're able to do to help people with bursitis. So I hope to see you in the clinic soon and on another webinar here on Eventbrite.